I am an infertility specialist. I am the founder of Mishra IVF Center, which is a part of Bhandari Hospital and Research Center in Jaipur, Rajasthan. To a mother during twin pregnancy. Hi, you couldn't hear me all this while. So, do you want me to repeat? Do you want me to repeat my introduction? All right. Okay. So I am Dr. Ruchi Bhandari, and I am the founder of Mishra IVF Center, which is a part of Bhandari Hospital and Research Center in Jaipur, Rajasthan. I am an I'm a consultant obstetrics and gynecology. I am a cosmetic gynecologist. I am an IVF doctor, an infertility specialist, and I have a work experience of about 10 years now. And I'm really glad to be speaking on this beautiful topic, that is the care to be given to a mother with twin pregnancy. It's a beautiful topic, and whenever you hear this news, a mother hears this news that she's pregnant with twins. This is something to be excited and to be worried about, right? So, first, let me go through the background of how twin pregnancies can occur and why do they occur. So, the incidence of twin pregnancies or multiple gestation has increased a lot because of the treatment that we give to infertility patients these days. We give them medicine so that more than one egg is formed during one cycle. Otherwise, in natural cycles, there is just one egg that is formed per cycle. So, because of these treatments, and because of IVF treatments, IUI treatments, all the injections and medicines that we infertility doctors do give, it has increased the incidence of multiple gestation. Also, because of pregnancies that are done after 35 years, naturally after 35 years, you tend to ovulate uh, two or more eggs per cycle because of increase in your hormones called FSH. And so naturally, beyond after 35 years, you can have higher incidence of multiple gestation. Also, if it runs in your family, then there are higher chances of you conceiving with multiple fetus. And so that is it. And now let me talk about the type of twin pregnancies. The most common type of twin pregnancies that you see is dichorionic diamniotic. So in this, both the babies, they have their own placentas, they have their own amniotic sac, and they have their own environment, and they are the most commonest and the safest. That is in terms of complications, the least complicated twin pregnancy this is, and this pregnancy goes on smoothly. Not a lot of monitoring is required. Then comes the monochorionic diamniotic, wherein both the twins they share one placenta. That is, the blood supply is through the same placenta, but they have two different amniotic sacs. So in this, there are high chances of different complications like twin to twin transfusion. That is, one baby getting more blood than the other, or one baby getting more food than the other. One acts as a parasite. So all of this can occur in monochorionic diamniotic twin pregnancy. Then there is mono, wherein you have just one placenta and there is one sac, and both the twins share the amniotic environment as well as the placenta. So in this, this is again a high risk pregnancy, and in this there are high chances of both their cords getting intertwined, or again discordant growth and all of that that is seen with monochorionic twin pregnancies. And then we have Siamese twins, wherein both the twins they have the same placenta, the same amniotic sac, plus they are conjoined twins, wherein they are joined through the brain or the heart or the abdomen. and this variety is full of complications. Now, as soon as you understand that you are pregnant with twins, which you get to know as early as 5 weeks of pregnancy, so there are a number of things that come into your mind, as in the number of visits to your doctor, the kind of nutrition that you would require, the amount of weight that you need to gain. So, starting from the first trimester, we divide your entire pregnancy into three trimesters, the first, second, and third, and they each comprise of 3 months. So, the first trimester is crucial because twin pregnancies come with higher chances of miscarriages. So, now that you have twin pregnancies, you need to go to for checkups every 15 to 20 days to your doctor, and you have to get some ultrasound scans according to what your doctor suggests. If you have a diamniotic dichorionic twin pregnancy, there's nothing much to worry. Your doctor will suggest that you take double the folic acid that a normal singleton pregnancy mother would take. So generally, it's zero point 0.4 mg for uh, mothers who are carrying a single child, but for mothers carrying twins, you have to take 1 mg of folic acid. And we also start iron supplements early in during the first trimester because there are high chances of you being anemic while carrying twin pregnancy. And your caloric intake has to be increased more than a single pregnancy. So it will be 600 calories more of calories you have to take than a mother who's taking if she's carrying a single child. So I will talk about the nutrition. So during the first trimester, what care you must take is gain about 3 to 3.5 kgs during the first trimester. Take double folic acid, take more of iron, and do get enough antenatal checkups from your doctor to prevent miscarriages. If your doctor suggests that you need bed rest, then you must take it. Otherwise, routinely, we do not advise for the same. First trimester screening, that is the screening for genetic abnormalities of the twins, is crucial, and this is done by a scan that is done between the 11 to 13 weeks of your pregnancy, and they see the nuchal translucency. The MT scan is done between the 11 to 13 weeks, and some blood tests might be advised to you. This will help if to detect if there is any genetic abnormality or not. Coming to the second trimester, now during this time, you might feel a relief from nausea and vomiting. So in twin pregnancy, you would definitely have more vomiting than what a mother with a single child does have. And this is normal because your hormones are, your HCG hormone is much more than a single pregnancy, a single child pregnancy, and therefore this relief from vomiting will come during the second trimester. And so during the second trimester, try to, if you are not on bed rest, start doing some form of exercise like yoga or any exercise under guidance, and maybe just a brisk walk would do. So start doing all of this from the second trimester. Um Take good care of your calorie requirement. Now, coming to your nutrition. So, your nutrition definitely you require more calories. This you should take in the form of high protein. So, you might be given a lot of protein shakes, 2 or 3 protein shakes, a good amount of fat in the form of nuts, a lot of vegetables, green vegetables, and your routine meals that you take. But in addition, supplements will be given to you so that your caloric need is fulfilled. During the second trimester, again, during the fifth month, the sonography that is done for structural anomalies is very important, and it is done at around 19 to 20 weeks. And this will detect if any of your twins have any structural abnormalities in the form of organs or bones. And this needs to be screened essentially. Now, from the second trimester, twin pregnancy carries two or three risks. One risk is of for the mother is gestational diabetes, and the other risk is gestational hypertension. So these are the two risks that can be carried, and women with carrying twin pregnancy have high risk of getting high blood pressure during this time, and so it is important that at every visit the blood pressure is checked, and if it is beyond 140 by 90 millimeters of mercury, then you need to take adequate treatment from your doctor, and you might need special care if this is detected. And in case you are detected with diabetes, so every month you should be screened for your blood sugar, especially after 20 weeks. There is a special test that is the oral glucose challenge test, which needs to be done. So this needs to be asked if your doctor has not suggested. Please ask for an OGCT test, and these are the two complications that a mother might suffer. And in the third trimester, preterm delivery is very common. I'll go with the question. I'll just finish with the third trimester care. So in the third trimester, it is possible that by before 36 weeks, there might be an early delivery because maximum twin pregnancy are delivered prematurely. So ask your doctor if any steroids are to be given for the lung maturity of your child at the gestation of 28 to 30 weeks, and please look for IUGR, that is growth restriction, is common in multiple gestation where the babies are less than 10% of what their estimated fetal weight has to be, and IUGR, the discordant growth, twin to twin transfusion syndrome, all of this can be detected through sonography. So a constant check of such pregnancies, twin pregnancies, is important through sonography, and regular sonographies must be done for twin pregnancies. Okay, so coming to the questions, what precautions should be taken during twin pregnancy? As I have mentioned throughout, from first, second, and third trimester, all of it I have just elaborated. So all these things must be taken care of. Second question. Nana, can you hear me? Okay, how much water do you need to drink when pregnant with twins? See, there is no fixed fixed amount of water that needs to be taken. So yes, take good sufficient amount of water of about 8 to 10 glasses per day, as required in normal pregnancy or in or otherwise. Is twin pregnancy high risk? Yes, twin pregnancy is comes under high risk pregnancy because of all the complications that I have just mentioned. But yes, dichorionic diamniotic pregnancies, as I have mentioned, go very smoothly, and delivery is also very smooth. So if you have a di pregnancy or twin pregnancy, then there's nothing to worry about. But a good care by your obstetrician is essential. Good amount of sonographies, good checkups, blood pressure checkup, weight checkup, everything is so a good high high. I mean, you have to show in a higher center. Do not go to a primary care health center for twin pregnancy. When should I stop working with twins? Okay, so you do not need to stop working if everything is going smooth during the first and second trimester, but it is always advised that from the trimester, please take rest because there are high chances of preterm delivery. Also, because you have twins and your abdomen is bigger than usual, you will feel uncomfortable, you will have backaches, you will not be able to work, you need more rest, you might have problems in breathing. So it's always better that by the third trimester you go on rest and you stop working. Any more questions? How much folic acid should I take for twins? Yes, so folic acid for a singleton pregnancy is 0.4 mg. In twin pregnancy, you have to take double of that, so you have to take about 1 mg per day. Folic acid does increase, and iron requirements increase in twin pregnancy. So my takeaway message for twin moms is do not worry if you are under good guidance and you are under the care of a higher obstetric center wherein you have all facilities for an emergency delivery, for NICU, that is the ICU for your babies, and it is nearby. There is nothing to worry about. Just have frequent antenatal visits with your doctor and maintain a good BMI, have good diet, and follow all the instructions that your doctor is suggesting. Then you can have a smooth pregnancy and a smooth delivery. Thank you so much. And if you want to follow me on Baby Chakra, please use the code Dr. Ruchi. Thank you so much. If there's anything, you can ask me on the app. Thank you. Thank you so much.